Stroke and women. Ladies, the statistics are not in your favor. Do you know stroke is the third leading cause of death for women? Nearly 60% of stroke deaths occur in women, and each year 55,000 more women have a stroke than men, and they are more susceptible to this problem compared to men. In addition to this, they are less likely to identify its signs and get proper medical care. Stroke kills twice as many women as breast cancer. Women live longer than men, and the prevalence of stroke increases with age. In addition, oral contraceptives, pregnancy with history of preeclampsia or eclampsia, gestational diabetes and postmenopausal hormone therapy pose special stroke risks for women. Although most women can safely use hormone replacement therapy, smokers and obese women are at higher risk for having a stroke. Women get autoimmune diseases 3 times more frequently compared to men. Lupus and similar inflammatory autoimmune disorders are associated with formation of blood clot or blood vessel breakage. Migraines are more common in women, and migraines with aura increase the risk for stroke in women 2.5 times. Most women typically put others first. They hesitate to ask for help until after they have finished their chores and taken care of the family members. Unfortunately, there is a history of gender discrimination in healthcare that makes women reluctant to seek the care they need. They often hesitate to ask for further testing or a second opinion, too. Most studies, tests, and treatments throughout history are focused on men, neglecting the fact that women have different risks for stroke and similar diseases and that they respond differently to a particular treatment. A stroke happens when the blood supply to part of your brain is interrupted or a blood vessel in the brain breaks. When this happens, brain cells are deprived of oxygen and nutrients. Within minutes, brain cells start to die. Memory, muscle control and other abilities controlled by that area of the brain are lost. A stroke is a medical emergency, and getting treatment as quickly as possible is life-saving. It is important to learn the warning signs of a stroke. Once you know the signs, get to the hospital immediately when the first symptoms appear. Stroke symptoms in women are more subtle, they are often not taken seriously. Furthermore, sometimes when women arrive at the hospital with symptoms, they are misdiagnosed until it is too late. The key to identifying these symptoms is that they come on very suddenly, and there is an acronym to make it easy to recognize and act on these symptoms. Think fast. Face. Ask the person to smile. Does one side of their face droop? Arms. Ask the person to lift up both arms. Does one arm drift downward, or is one arm unable to raise up? Speech. Ask the person to repeat a simple or common phrase. Is their speech slurred or strange sounding? Time. If you notice any of these signs, it is time to call ambulance. Do not drive yourself to hospital. You need to get to the hospital where experts are trained in the diagnosis and treatment of stroke. Women are likely to experience symptoms that are different to those typical for men. Sudden numbness of the face, arm or leg, sudden trouble seeing in one or both eyes, trouble walking and sudden headache that feels like the worst headache of your life. Nausea or vomiting, pain, general weakness, seizures, confusion, unresponsiveness or disorientation, sudden behavioral change, loss of consciousness or fainting and hiccups. It is worth noting that around 80% of strokes are preventable with lifestyle, medications, exercise, diet, and medical care. Many factors that increase a person's risk of stroke, and some of these also increase the risk of a heart attack. They include being overweight or obese, physical inactivity, high blood pressure, high cholesterol, diabetes, personal or family history of stroke or heart attack, and being age 55 or older. Most people manage to recover after a stroke, but about 2/3 of the victims experience certain level of disability. In other words, if the stroke does not kill them, it might leave them paralyzed, unable to walk, speak, or live independently. These facts are alarming, but there is some good news. Up to 80% of strokes can be prevented. This means it is important to know your risk of having a stroke and to take action to reduce that risk. Thank you.